Pankhania is joining me now from Bath in the UK. He's a senior clinical lecturer at the University of Exeter Medical School. Welcome to the programme. Always a pleasure to speak to you. However, it seems that pain we felt at the beginning of the year is coming back. People are tired, Dr. Bharat. In European countries, was a lockdown the only option, especially in the UK where you are?
Well, unfortunately, the lockdown in the UK that has just been announced to come into force on Thursday is a necessary measure. And it is very unfortunate that it has to be a necessary measure because we cannot carry on like this with this open up, lockdown, open up, lockdown. We need to get our act together. And one way to get our act together is to do better infection control. So everyone, every place, every establishment, every citizen takes responsibility for having good infection control. And then, of course, better testing and tracing. If we do these measures and learn from the Far East is very good. Look at Korea, look at Vietnam, look at Taiwan, look at Singapore. They've all done a good job.
Dr. Bharat, sorry to jump in. That was my next question. In these past few months, have they looked to these countries and their successes or not?
I wish they would, because sitting as an independent doctor, I feel you're missing a big trick, which is look at the successes of the Far East. Don't be so proud that only the West knows how to do these things, and copy them, because the Far East knows a lot about these pandemic measures, and they've done a really good job.
And you know, we sit here as journalists and we cover the world and we look at the Far East and then we get to Europe and we just think, can't you look at that example? I mean, it must be very frustrating for you. I mean, I'm just a journalist, but you as a doctor, as a scientist, will this time round be any different? And as you said, you know, open up, lockdown. Is that going to be what we're going to see, let's say, I don't know, December? Another opening down and then numbers rising again?
I just hope our leaders will learn, because if they do not sort out health, the economy doesn't get sorted out. And if you sort out health, economy also gets sorted out. And we need to sort of grasp the nettle and do the difficult thing, which is instruct people, to begin with the people, that you will do strict infection control measures, which means wear your mask properly. And the second thing is allow businesses to trade, but trade safely. Then finally, as you say, as I'm saying, learn from the Far East. They've done a very good job. No need to reinvent procedures when already we know other people are doing a better job.
Exactly, no need to reinvent procedures. You mentioned wearing masks. I myself, I am from the UK. I saw a huge difference in the amount of masks being worn in London, my hometown, compared to where I live here. Will that change? Will it become obligatory to wear a mask? Here, I walk around, people wear masks. In London, I was very shocked that they didn't.
I think this is a failure of messaging and failure from the highest office in the land, because we need to, you see, there was a lot of reluctance. If you look back, you will see Prime Minister Johnson was very ambivalent and not keen on masks. And then finally, when he accepted masks, it was half-hearted. And I, as a scientist, can say, look, if you wear a good quality mask, it reduces infections considerably. So why not do it?
All right, we'll leave it there. Thank you very much. Always a pleasure to speak to you, Dr. Bharat Pankhania. Thank you.